Atrial fibrillation, also called Afib, is the most common type of irregular heartbeat. It can turn into heart problems like blood clots or a stroke. Joining us now to explain how to stay heart healthy is Mercy Cedar Rapids cardiologist Dr. Mark Milton. Thanks for being here today, doctor.
Thank you for having me. I appreciate it.
And tell us, what is Afib and why is it an issue?
Atrial fibrillation is a rhythm of rapid disorganized electrical activity in the upper chambers of the heart, so that instead of contracting normally, the atria just quiver. Blood clots can develop in the upper chambers, which can then float up to the brain and cause a stroke. Also, because of the loss of atrial contraction and the irregular and rapid heart beating of the bottom chambers, the blood flow to the rest of the body can be reduced.
And who is at the greatest risk for experiencing it?
Well, the most prominent risk factor for atrial fibrillation is underlying heart disease, whether it's coronary artery disease and prior heart attack, or hypertrophic cardiomyopathy, congestive heart failure, valvular heart disease, congenital heart disease. That's the main risk factor. But other contributors include high blood pressure, diabetes, obesity, obstructive sleep apnea, kidney disease, also substances like alcohol and stimulants can trigger it as well.
You talked about what goes on in the body, but what about when you're experiencing it? What are some of the symptoms that people feel?
Well, the most common symptoms are fatigue and weakness. People can develop shortness of breath with activity or more severely at rest. People can get chest pain when their heart rates are rapid. They can pass out. But the more concerning symptom is no symptom at all, because occasionally a person's first awareness of atrial fibrillation may be when they present to the hospital with a stroke.
Yeah, very scary at that point. What treatments are available if you do know about it?
Well, I usually recommend or offer two different paths. One path is to allow someone to be in atrial fibrillation and simply control the heart rate. The other path is to try to keep them out of atrial fibrillation. And for that, we have rhythm drugs that can help prevent recurrence, or we have an ablation procedure that we go into the left atrium and we electrically isolate the pulmonary veins, which is where the prominent triggers for atrial fibrillation originate. As far as stroke prevention, we recommend people with the appropriate risk factors be on a blood thinner. And for those who can't tolerate blood thinners, we have the ability to close off the left atrial appendage. That's a sock-like structure that hangs off the left atrium, and that's where 90% of blood clots in atrial fibrillation develop that can result in stroke. And if we close off that structure, then eventually we can potentially get patients off of blood thinners.
All right, some great information you shared with us for February Heart Month. Dr. Milton, thanks for joining us here today.
My pleasure. Thank you for having me.
And stay with TV9. We'll be right back.